Very fantastic. So it's going to be great. That was really, wow. It's like, it's not just fireside. I feel like I'm close to the fire, right? Because he's there. He's where it's happening. And it's not just because he's sitting in first class with Tom Price, but he's in the conversation, and now you're in the conversation. And so, Les, I hope you'll be staying around because we all have lots more questions, I'm sure. But that was fantastic. I saw a lot of people tweeting, so that's great. You can put it up on Facebook Live, too. We've been doing that. Always use the hashtag Rise2017. Donna, my Vanna White. I feel more like Pat Sajak, I think. The clicker. I might have put it, I might have lost it. So anyway, so I'd like to introduce Troy Bannister, who is from Startup Health. You guys, everybody knows who Startup Health is, right? Also introduced on stage here in 2011, I believe, when Unity and Steve first started it. It's great to see what they've done. You guys are up to, what, 170 portfolio companies? 184, wow. And so we'd love to hear their state of the digital healthcare revolution, as they are right in the middle of it. So big round of applause for Troy Bannister, Analyst, the guy close to the data, close to the startups. Here you go.
Perfect. Thank you, Alex. Thanks everybody for having me. It doesn't matter how many times you come up on stage and doing these, you get a little jittery. So what I'm going to do today is just run through what's happening in the digital health market. We got a good insight from the previous presentation about some outlooks, but the numbers behind it, whether they are indicative or not of, is they're going to be returned, tell a very direct story. And that's a story of increasing revenue. It looks like the format's a little bit off, so bear with me. What we're seeing is an increase in funding, plain and simple. There's more money coming in, there's more investors, and it's increasing at a pretty quick rate. After 2013, we saw a big jump, more than a double increase over those 2 years. And not to mention that, but a lot more investments. What's actually happening, though, is we're seeing more money in now the same amount of investments. So the funding is becoming larger in numbers, and that is dollar number, but less, or I guess flat in the amount of funding events. So we're seeing people now learning about what's happening in the market, what's working, what's not working, and doubling their money on the ones that are working. If we look at kind of the investment trends, we do see a positive trend line here. So there is an increase, but from month to month, there's obviously ups and downs. We see a lot of really big deals happening around the world too. Oscar Health, which we'll have the pleasure of hearing from later, had a big $400 million deal. Zenefits, also a $500 million deal. Some of the outliers that are both in New York City kind of throw those numbers up. If we look at the investment speeds, we've kind of taken a look at between the seed investment and the Series A investment and how long that takes from sector to sector. So we define a lot of different types of sectors. We have about 12 sectors. Patient and consumer experience is one, medical devices another, big data analytics, clinical decision support, and personalized health quantified self are some of the larger sectors. Interestingly enough, they all are pretty much around the 15-month area. So it takes about a year and a half or so to raise your A round between that and your seed round. Of course, it's different for the type of company you're building, but if we look at this on a year-to-year perspective, it's actually getting faster. So companies are learning how to find the right investors. The investors are now more confident in picking the companies to invest in, and has truncated that time down a little bit. So I talked a little bit about these big deals, and here's a list of some of them from 2016. So just last year alone, we saw over $2 billion in just 10 deals alone. That is ridiculous compared to the history of digital health. It used to be 10, 20, $50 million at the most. Now we're seeing $500,000 deals with Zenefits. Internationally too, some really big deals on Duo and Ping An Good Doctor out of China. We're seeing China and some areas in Europe starting to really double down on digital health as well. Most of these deals are really kind of basic companies. They're not special, they're not kind of full of features, but Ondu, for example, is a platform for finding a good doctor in your area. It's very, very similar to ZocDoc. But when you're looking at China, that's a big deal. If you're in China, everyone has a smartphone, but not everyone knows how to find the right doctor. So the opportunity for revenue here is huge, especially when you're looking at volume plays like with the billions of people in China. Oscar is another great example, which again, we'll hear from, I don't know if he's here yet, but Oscar is a very high-tech, kind of really interesting type of insurance company that's popped up over the last few years. It's really starting to dominate the New York and Jersey areas. So these are those sectors I was talking about, the top 10 most active sectors. And we've kind of created definitions around these. Patient consumer experience being the number one, 2.8 billion. And this is a really kind of obvious sector, right? It's using your smartphone to connect with doctors, using your smartphone to enter information and get a diagnosis or a care plan or find the right medication. It's how a person experiences the healthcare industry in a different way other than going to the doctor in the traditional sense. Wellness companies can kind of fit into the benefits insurance area, but also a lot into the preventative area. Personalized health, quantified self, this is kind of the immunology, the cancer, personalized healthcare with cancer analytics and tumor sequencing. So you can kind of see that those are the three big kind of areas. Again, patient consumer experience being number one. This is one of my favorite graphs. I'm kind of a graph nerd. It's called a heat map. It shows the darker areas being the more active areas. So when we're looking at patient consumer experience, as we saw as the number one most active area, we're seeing a lot of funding events in the seed round area, which means there's still a lot of innovation happening there. There's a lot of investors putting in small amounts of money into different new ideas. So there's still, even in 2016, this is back to 2010, I have a different one too, we're seeing still a lot of activity in these early stage innovation areas. So it's not drying up yet. We kind of expected it maybe to, but it's still not. There's still a lot of activity in the seed range area. So we're seeing, again, I kind of mentioned this earlier, these round sizes are increasing. The average seed round is now the average A round. Or I guess it's the other way around. The average A round used to be the seed round. So the kind of lines between what is an A round, what is a seed round is blurring because there's more money being put into it. So you have to have a better sales pitch and a better pitch to get that seed round. But when you do, it's going to be more money and it's going to carry you farther. So again, these investors that we're working with and that we're talking to are really understanding now what's working and what's not working and willing to put more money on the things that are. This is another really positive graph. So we're seeing more investors come in year over year. And we actually saw a 42% jump just last year alone. That's crazy. Even in 2016, there are now almost 50% more investors willing to participate in digital health. This is also there's a lot of variety behind it. We're seeing a lot of corporate venture. We're seeing a lot of angel investors. We're seeing a lot of hospital systems willing to put capital into startups and work with them and co-develop a product. Both on a shared risk type of model. And this is new. It used to be internal innovations. If you look at pharmaceutical companies, they used to have huge spending budgets for internal R&D. That money is now being pushed outside of the pharmaceutical company and used to purchase innovation, or I guess at least invest in innovation. And then they test it internally, and if it works, they'll put more money into it. So we're seeing with a lot of our companies in our program. So I think this is the last slide, and maybe we can do a quick Q&A, because I kind of flew through this. These are the top investors. We're actually listed there, which is a little toot of our own horn. But again, the variety here is amazing. Intel Capital had 7 investments last year. That's in digital health. 500 startups, a very different model. This is kind of an accelerator. Safeguard Scientific, another different company. Blue Cross Blue Shield, an insurance company. Look at how amazingly diverse this is. It's every player. We're seeing now Under Armour. We're seeing Ford, a car company, starting to invest in digital health because, as we saw from Teladoc, why not have a doctor in your car? If you're experiencing chest pain on the road, if you're experiencing sleepiness, why not have a medical professional ready on standby to connect with you? The variety here and the implication of where digital health can live is pretty much limitless. So I think that's the whole presentation. I flew through that. I want to see if there's any questions, and if not, we can switch it off to the next one.
Are there any questions? I have one. Okay, Francie's better. Go ahead, Francie.
Just an easy question. Some of your charts are really cool. Will they be available online anywhere?
Thanks. So if you go to startuphealth.com/reports, we do one every single quarter, and they go all the way back to, I think, 2010. We also are going to be launching our interactive version of this in the next couple months. You'll be able to choose time ranges, filter by subsector, look at Series A companies, whatever you really want to slice and dice it.
That's great. Thanks, Troy. One more question from Donna Cusano.
I've just noticed, because I've been following you for years, companies can get from A to B fairly easily, but the B to C continues to be a problem. Any insight on that?
Yeah, I think this goes back a little bit to what the last presentation was going into. It's difficult for companies in healthcare to demonstrate value in the hospital. It's a catch-22 at the earlier stages because you can't get a pilot until you show an ROI, and you can't get ROI until you do the pilot. And you can't get a funding event. You can't raise funds unless you have data to back up a solid product. Once you get through that and you start getting some customers, it becomes a real question of, is this a money maker? What kind of margins do you have? And that's kind of where that B range comes in. It's really difficult. That's really where the bottleneck is. And what we think it comes down to at Startup Health is really the mindset and the way the company is presented. Every company generates value, but how do you tell the story and who is the right investor? So the number one thing we do at Startup Health is identify who that investor will be and then what you need to say to them. What kind of value are they really looking for? How do they want to hear it? That's the trickiest part of this. It doesn't matter if your product cures cancer if you can't communicate that. So the right way to communicate it is everything. And investing is it's a social game. It's not a clear numbers game through and through. So I know that's maybe not the best answer, but it's really kind of narrowing down the storytelling attribute.
It's the right answer.
Thank you.
Okay, big round of applause for Troy and Startup Health.